Hello and welcome to Psychology of Learning and Motivation. Our topic of discussion is schedules of reinforcement on individuals with disabilities. We will be going over the background, 4 different articles, and a comparison of the topic. Schedules of reinforcement is a rule describing the delivery of reinforcers for a behavior. These reinforcers include fixed ratio, variable ratio, fixed interval, and variable interval. In Article 1, schedules of reinforcement were used to examine contrast-like effects with children who had disabilities that needed behavioral intervention. Caregivers were given a black baseball cap to see how often the children were probing for their demands, a verbal behavior for a want or a need. Attention was given to the participants after a fixed ratio of attempts to determine how often the caregivers were probed. The point of the study was to determine whether a stimulus had any effect on behavior intervention with a fixed ratio schedule. Schedules of reinforcement were used in behavior intervention with the stimuli of a black baseball cap to determine if the behavior decreases as the attention from the caregiver was on a fixed interval. Considering only one of the participants had consistent data, the results are to be taken with discretion. The results of the article concluded that there is an increase to an unchanged stimulus, no black baseball cap, and a decrease with the changed stimulus, a black baseball cap, in correlation to how much attention was given to the participants. Past research is consistent with these findings, but they removed the rules to add the probes from the caregivers. This correlates to the textbook by showing how those on a fixed ratio schedule have a high rate of success when performing the action. Rats performing on a fixed ratio schedule had a higher rate of success. The article included a black baseball cap and probes, which help identify how the reinforcement is either aiding the participants or hindering their behavior.
The article I chose is titled An Individualized Method for Establishing and Thinning Multiple Schedules of Reinforcement Following Communication Training. The aim of this study was to teach children with significant developmental or behavioral challenges to effectively communicate their needs or make requests without resorting to disruptive or harmful behavior. This was achieved utilizing an individualized reinforcement schedule and slowly reducing the amount of rewards offered. The purpose was to find and apply an incentive program tailored to the participants' needs that was not only realistic for them, but practical enough for them to use in their daily life. Um, Schedules of reinforcement were utilized to regulate the frequency of rewards. Again, this was taught to children with behavioral challenges, and the goal was to teach them the appropriate times to make requests while reducing the incidences of problematic behavior. Researchers discovered an individualized schedule was the most effective for the majority of the children, with the exception of one child. Problem behavior remained consistently low even after the gradual diminishing of rewards. Um, this study related to the course by illustrating a real world example of the concept of extinction. In Chapter 7, the concept of extinction was first introduced as a means to decrease certain behavior over a period of time. In this case, extinction was utilized to decrease problem behavior by not giving a reward when bad behavior occurred. Additionally, requests were also not granted or reinforced, during the delay period, further emphasizing the significance of waiting for the appropriate time to make demands.
In Article 3, they obtained 2 participants, both with developmental disabilities, and they conducted a functional analysis to determine their type of problem behaviors, which was escaping from demands. They then conducted a functional communication training that had a fixed ratio, resulted in timing, meaning every single time that they were presented a green card or light, they were given that break. They then used multiple schedules, so the fixed ratio showing the green colored items and the extinction when shown red card or light, they were not given a break. To control their usage, they used a compliance of reinforcement, meaning when break was not allowed, they were given a snack or other type of activity, and response blocking, meaning they were not able to ask for a break. The point was to determine whether individuals with developmental disabilities could learn an appropriate way to ask for an intervention, meaning break, without their problem behaviors. Some of them were things like aggression, disruption, and self-biting. So the study used multiple schedules by having a fixed ratio showing the green card or light and the extinction showing the red card or light. In this case, it was teaching them when it was appropriate to ask for the break, which implemented timing into the study. The implementation of negative reinforcement was to minimize their problem behaviors as much as possible. So what they found was that the implementation of their first schedule of reinforcement, which was a fixed ratio, were able to strengthen the two participants' ability to learn when it is necessary to ask for breaks in an appropriate way. Adding the extinction helped minimize their negative reinforcement, in this case, the problem behaviors, and the need for compliance of reinforcement and blocking was to help mitigate their usage. So in the textbook, it mentioned a pigeon pecking on a disc, which trained them to obtain grain. This study also had the alternating stimulus between, I'm pretty sure it's the color of lights. Very similar to this study, which had the green light or card being shown, or the red card or light being shown, teaching them about timing and receiving that break. The figure on the left shows the rate of problem behavior per minute during functional analysis, and the one on the right shows what they did all together throughout the study, but without functional analysis.
The article I chose is called Employing a Fixed Lane Multiple Schedule in the Treatment of Challenging Behavior for Children with Autism Spectrum Disorder, or ASD. Researchers wanted to investigate the best way to teach children with autism appropriate and alternate methods to communicate that they want something, called a Functional Communication Response, or FCR. The issue that they wanted to tackle is that FCR is useful, but there are times in which it is utilized by the child when the item that they're asking for isn't readily available, say that they want pizza super late at night, or that they're asking in an inappropriate place, say they're out in public, at the doctor's office. This study is meant to find an applicable strategy for FCR that can tackle this problem. In their study, the researchers had multiple phases in their methodology, but the most notable one related to our topic is where the researcher would wear alternating colored wristbands, green or red, and tell the child that they were with, if I'm wearing the green wristband, you can ask for this item that you want and I'll give it to you. But if I'm wearing the red wristband, you can ask for this item that you want, but I won't give it to you. This showcases the usage of multiple reinforcement schedules, including a fixed ratio of 1-to-1, in which if the child does something, they'll be rewarded for it immediately, and an extinction schedule, in which no response or reward is given at all, even if the child utilizes FCR techniques. The researchers learned that the method they used is feasible and applicable to real life. However, that the study could still use some work because the participants they used were unpredictable, and that affected how some of the future stages of the experiment went about. Looking at the data, something interesting I noticed that relates to our course and textbook is the concept of extinction bursts. Present within those extinction are red band components of the study. The graphs indicated a spike in what the researchers called challenging behavior in those extinction phases as a result of the child not getting any response at all from the researcher. Comparing the articles we gathered, there were lots of similar and shared items within studies. The articles we chose focus primarily around autism spectrum disorder and functional communication training, an intervention that seeks to change challenging problem behaviors into alternative methods of communication. MANS in applied behavior analysis can be thought of as requests from the individual, and that concept, though not worded in that way, is consistent through all articles. Fixed ratio 1 and extinction mixed schedules were often utilized in many methodologies in an attempt to reinforce good behavior consistently, but also learn to remove problem behaviors. Many of the articles also had small sample sizes within their study. From what we learned, a lot of the data supports that FCT is a useful and effective strategy, though research on how it can be implemented with mixed schedules can still be done. This involves FCRs utilizing alternative stimuli, discrimination between settings or caregivers, as well as finding other potential variables that may affect the rate at which patients may experience resurgence in problem behavior.